On behalf of the Center for the Treatment of Developmental Trauma Disorders and the National Child Traumatic Stress Network, welcome to this roundtable discussion on the intersection of race, ethnicity, culture, and identity with child trauma. You'll hear the questions and formative experiences that have emerged for 5 child and family trauma therapists as they reflect on and grapple with the dilemmas and uncertainties that face all of us in our work with traumatized children and families. We recognize that this group of therapists, although diverse in background and identity, cannot represent the full range of diversity of therapists. So please plan on joining us again on future roundtables where we will convene a variety of other therapists. But for now, let's hear from our participants on this, our inaugural roundtable. It's great to be able to talk with all of you about such a crucial set of issues and to be able to actually hear from you. I'm looking forward to learning from you about your reflective process as we consider the really complex issues involved when working with children and families who've experienced developmental trauma and who come from backgrounds that are so complex in terms of race and ethnicity and culture and identity. So let's talk about your experience now and how those factors have played in and what you've learned and what questions you have. Would anyone like to start? Monique?
Sure, Julian, I'll start.
Thanks, Monique.
So, as a therapist, I was trained very behaviorally. That was my background, cognitive behavioral. And my very first job was in a juvenile correctional facility, and became pretty much what I've done most of my career. And I had worked with adolescents in the community for my training and at children's hospitals, but when I got to the facility, I felt a little out of place in terms of my understanding. As an example, within probably the first month of me being there, I was called to see a young man on one of the units who had just gotten into a physical altercation with another young man. And as part of the process for being able to resume activities, he had to be able to process what happened. So I brought him into my office, and we'll call him Jonathan. I asked Jonathan what happened, and he said, well, the guy bumped me, and so it was just on. And I said, okay. I was trying to understand what bumped you, how, what happened, and like, why are you asking me that question? He bumped me, and so, I beat him up. And so to me, bumping, I didn't quite understand how bumping would lead to such a severe altercation. And yet Jonathan just kept looking at me like I should understand what he's talking about. It was something that I didn't quite understand for really years, but looking back and thinking about the case, I began to work with Jonathan, and I understood a little bit more about who he was. He was a young man who, probably from the age of maybe 6 or 7, was living in a home where his father was relatively physically abusive. But that really wasn't the worst part. Most of it seemed to me to be more emotionally abusive or psychologically abusive. So he would, on a regular basis, say, you're not worth anything. You won't amount to much. But on the other side, you have to be a man. You need to stand up for yourself. And this was 6 or 7 years old. So when things would happen in the community or at school, Dad's primary advice was, if you don't take care of that, then I will basically beat you up, however you want to put that. But so the child learned that your response to someone who offends or harms you is to basically get back at them to physically act that out. I began to understand that really what this young man was responding to was what I think Dad would have said is, you can't allow someone to disrespect you. You can't allow someone to put you down. And disrespect in some way is disempowerment, and the father had been disempowered many times throughout his life. And I think his goal was to ensure that his child could stand up for himself and make sure that he sustained some level of power or empowerment and control. But in that, the child developed some very kind of aggressive traits that often over-responded, as though his father was always in his ear saying that.
So that's a perfect example of how there's a young man who intergenerationally, his father, perhaps others before him, others in his family, and he now are really responding in that kind of survival mode. I have to do what I have to do to protect myself. But you're also highlighting, I think is so crucial, that that's a norm that he was learning. He was learning this is the way that a man handles things, and he was learning it in a very frightening and a very hurtful, but a very powerful way. And that was a norm that you weren't familiar with from your background.
No, my worldview is very different. And so, I genuinely believe that I probably would have said, I'm sure it was an accident, because my belief system says, defaults to, most likely people have good in them, and that their behavior would reflect that. So most likely an accident, whereas this child's view is most likely intentional, potentially harmful, and I need to let them know now, otherwise I could be subject to victimization in the future. Or, that little voice of dad would say, how did you respond when he did that?
So you've really done some important reflection to figure out why, in this case, a bump is not just a bump.
Right, a bump is not a bump.
And
a bump in my world and a
that
bump
young
in his world
man,
are different.
his reaction made entirely good sense.
Mm-hmm.
And if you didn't understand that, then you don't understand him.
Right.
That's a great example to start with. Does that spark any experiences from anyone else? Carmen?
Well, I am thinking about two pieces, reflecting on Monique's example. For me, because I am an immigrant woman, an immigrant therapist, the issue of identity, race, class, and all the pieces of my identity became really present when I migrated. Before that, if you ask me what was my culture, nobody asked me that while I was in my country. So as an immigrant therapist who speaks Spanish, I began serving immigrant families. And most of the families that I serve have very young children, and they have experienced very difficult situations and traumas as the result of immigration. And a big percentage of the women I serve are indigenous women from Central America who have been impacted not only by immigration trauma, but by other traumas, in particularly oppression around ethnicity, religion, and they have young children. So clinically, I have been able to see the impact of historical trauma, although at the beginning I couldn't name it. And then as I became more aware of or made the effort to understand the historical and sociocultural context they belonged, I understood that there were all these stories of horrors or oppression that were either told or not told, or repeated through relational patterns that continued to the present, and that are exacerbated by other traumas, including immigration trauma. So how others see these as it might be a mother who is unavailable or dismissive or maybe emotionally abusive, for me, it has a different interpretation because it's the impact of this oppression, and unless I raise or open the space to talk about oppression and how you are not less than, but this was something that happened to you, I cannot address the relational piece. And so I have held all of that in mind and have held my own history as an immigrant. However, I had this fantasy that because I was, or I am Latina, I am brown, I have an accent, these women were going to identify with me, and they were going to be happy to work with me, without realizing that I was in a position of power. And it was not until a very brave mother told me, I don't trust you because you are Blanquita, you are white. And that was a shocking moment for me, because I had gone through all this process where I didn't identify as white any longer, that I realized that I am mestiza, that I have brown skin, and for her to say, you are white and you are forcing me to be here, was a big lesson, because if I had been working with a white family, I would have asked, how do you feel about working with me? But because I had this assumption, I didn't ask this mom. And that was my implicit bias, that was my assumption, and it was a very important moment in my professional development, in my development of my identity.
So the evolution of your awareness of your own cultural history, experience, your definition of who you are as a person was not the same as how this client saw you.
Exactly.
This mother saw you from her perspective.
Right.
Which, even though there might be many similarities in language and outward appearance in some respects, there's still a fundamental difference in her experience and yours.
I have so much levels of privilege, right? Like, I have not experienced the type of discrimination that she has experienced, or these, as I was mentioning, this historical trauma that her ethnic group experienced. And then I am not a single mother, undocumented, trying to raise this child. We are very different, and then I forgot that.
A powerful example of how much we can not be aware of while still being aware of so much. You were so carefully thinking about so many of these issues, but this particular mother reminded you that there's still more.
Can I just ask a clarifying question? It sounds like your case was maybe a family that was ordered or to therapy, maybe
suggested by everyone.
So child welfare or something else. So you kind of held their future in your hands. So trust became an important component of that. I mean, she really needed to be able to trust you to be able to do the work.
Yeah.
Maybe not so different from that young man who needed to trust you in order to do the work that he needed to do.
I held the keys to his
That's right.
eventual release.
That's right. And there's a lot of power in that.
Yes.
But there's also a lot of opportunity. How interesting, yeah.
Whenever I know that I'm working and I have this privileged position of, holding on power, especially when I work with marginalized communities, many times I struggle when I know that there might be a possibility of using the power, right? Such as doing a mandated reporting, right, to a client. So I vividly remember just recently having to do that, and how much I struggled with the idea, because even though I'm not really on their shoes, I think that I had some also experience of disempowerment in my own life, and trying to balance how that is in terms of, feeling that disempowerment and feeling helpless and trapped, and now using my power to maybe potentially, having some similar reactions to a person who I'm trying to provide the best services that I could provide, right? So in this case, you are always trying to balance it, but also trying to figure out there are so many things that we do and are in our control, and some things that are completely out of our control whenever we decide to make a call or to to do a report. So in this case, this is a father, a single father now, trying to support his child, having a history of multiple traumatic events himself, and now also the child experiencing some trauma too. So we understand that this was intergenerational. They crossed the border. They were separated for a few months, and they come and they are faced with a reality where it's a very challenging reality, right? And brand new to this country, trying to sort of figure out what's next, how he can provide for his family here and his family back in his country, and not knowing exactly what to do, feeling so stressed out, and doing the thing that he probably could do, as a surviving the moment of making sure that that he was working, but also at the same time getting some relief by drinking, and putting his child at risk inadvertently, right? So how do you break the news to this father that you're going to do something that you hopefully, potentially, you're really taking this leap of faith that, he will get the support that he needs, but you cannot guarantee it because it's out of your hands. So those are the moments that, I think that as a clinician, I truly struggle, and obviously as an immigrant who have my share of experiences in my personal life of feeling disempowered, I definitely always question myself if I'm overusing my own power, or when are the moments that I still have to keep myself on check to figure things out a lot closer. So
that really highlights how power is such a ubiquitous issue when we're thinking about race, ethnicity, class, identity. And power can be so helpful, but it can also be so hurtful. And I really hear what a struggle that is for you to not use that power in a way that actually causes additional stress or even harm for the clients you're working with. And your background informs you about that, but still you're not in the same shoes as that particular client.
That's definitely true.
Rocio, your story and Carmen's story kind of summing up some things from my history too. Different in terms of my assumptions going into working with a very different cultural family, and my blindness to the power dynamics going on. It must be 17 years ago when back in Long Beach we have a large Southeast Asian community, and I was working with doing family-based work. And part of what I do is I develop programs, so I had this time-limited family-based program working, I believe it was a Cambodian family working with a mother, daughter, and a father for this part of it. And I remember, I'm stuck in my head and I'm going, okay, we've got only so many sessions, and I want to, identify the challenges for mom and dad, but also for the daughter. And my speed of doing things was off sync. I didn't learn this till later, after they dropped out of therapy. Mm-hmm. I learned things when things go bad, right? I felt like, I felt like we needed to get through this work in a set number of sessions. What I became aware of afterwards is that I didn't have enough in the bank with this family. They didn't know who I was, and I'm this old white guy, even back then, and so there wasn't enough, certainly the trust there, and I'm trying to move too quickly. And they were coming from very more traditional background that I wasn't completely familiar with. And so I was the daughter as the more from this, being the translator in many ways for this culture. I was reading her, and she had very different approach in her idea of roles and how she should be with the family. So there was conflict between mother and daughter, and she was moving away from the family, being more independent. And I was, even in some small way, advocating for the daughter to give her a voice, but that undercut my relationship with mom. So two things I learned is that my pacing was off, and also my deep understanding of this culture and the family dynamics was off. And so I hope I've learned, I've really changed how I do things, but that was I've had a number of these formative experiences that go whack me on the side of the head.
Those clients taught you something by communicating through their actions.
Hopefully my subsequent families get the benefit of that, but yeah, and I still feel badly about that.
Has that led you to get to know other families and their culture and background better?
It really has, and it has slowed me down and recognize that I need to build in a lot more time, especially when there is the cultural gap, but I have to let them teach me. Even though when I think I'm familiar with the culture, I've worked some years, but each family has its own culture too. So I've got to be taught, and I have to build a lot more flexibility into how I do the work.
Great reflections.
I'm wondering about the piece of being you a white male and serving, diverse families. How have you addressed that?
I go into it being much less the supposed expert. Early on, I did international work, and they kind of just drop us in the middle of these situations, and they go, "Okay, these guys are going to fix things," and it was misguided. So I adopt a lot more humility and a more of actually a tentative tone when I'm working with a family, and I am trying to be very mindful of the dynamics and the power dynamics perhaps. So my style of working is very different, and I want to be taught by them in many ways. Is that getting at what you're talking about? And also, and trying to learn and consult with my colleagues who either come from the culture or the community. Exactly.
Yeah, so you have done your own process to get to learn, to know the families and then yourself.
Yes, and to take a very different role than I started out with 20 years ago. Exactly.
If I could jump in on that question as well, what it triggers for me, also as a white male, as a cisgendered white male, I have learned over time when working with clients that don't appear to mirror my experiences, to be much more proactive about that than I used to be in my work. I used to make that the client's sort of issue. I'd wait till they brought it up, and if they didn't bring it up, okay, then I assumed it wasn't an issue for them, and quite honestly was relieved that I didn't have to deal with it. And then I realized that's my responsibility, to acknowledge the obvious. And so really as early as possible in my process with clients, I will talk about, let's also talk about how you perceive me to be similar to you and how you perceive me to be different from you, and how does that impact the kind of work that we want to do. And that's taken a lot of years of learning and mistakes, but also recognizing that I think, for me anyway, it's my responsibility as a clinician to acknowledge that in the room and to not make that always have to be the client to point it out. So I don't know if that's part of what your question was as well.
Yeah, that piece of the responsibility and how we need to do the homework and not necessarily expect that families are going to inform us or educate us.
Sure, because again, also with that power differential, right? We're the expert, we're the authority. So I don't want to, if I'm the client, I don't want to challenge that, or may not even think I have a right to challenge or question it or acknowledge it. What if all of a sudden then I say, well, I'm not going to offer you my services then? You know, that's a vulnerable position to have a client challenge us as the clinician in any sort of way, because they may lose the access to that resource, or at least that's their perception. And that has taken me years to understand and appreciate that privileged position that I'm in and the power differential that goes with it.
Very different kind of homework than the kind of homework that we as therapists are often used to thinking that we can assign to our clients, which is not necessarily the best framework for doing therapy to begin with, but the kind of homework that I think you're both talking about and that Bill's talking about, actually that all of you are talking about, is really the homework of being open to actually learn from and offering the invitation, realizing that if we don't offer the invitation, the perception easily could be, I'm not allowed. I can't say that. I can't tell you I don't trust you. I can't tell you that I think you're different than me. I had a young man, a young African-American client who said to me fairly early on, you don't understand me. You're from the suburbs. And I thought, my first instinct was, but I'm really trying to understand you. But actually, I realized the only authentic answer at that point was, you're right. You're absolutely right, and I'm so glad you said that. Now maybe we can talk. And if you don't feel that I do understand, then that we know part of why. And let's see if we can bridge that. But Al, I was wondering, do you think of any particular encounter where either you did or did not offer that, or did or did not hear that from a client about the differences?
I think this answers part of that question, and it also answers the initial question, I hope. And I want to take the discussion to another aspect of identity and culture as well, if I might.
Please.
And when you asked the question, I flashed back to a number of years ago when I first began working at a child advocacy center, which is where I continue to work at, in the mental health treatment component. As part of the child advocacy center, we also had a forensic component, and those are people that are specifically trained to interview kids where we have reason to believe that they have been harmed in some way, physically or sexually or emotionally. I was referred a case that had come through our forensic department 3 times. The same boy had been brought in by law enforcement, a 13-year-old Latino boy with what, according to the referral information, with a developmental disability. He had reported on 3 separate occasions having been sexually assaulted in a public park by an adult male, different adult males. Each time he had been brought in for an interview. Each time he was counseled, and his family was counseled and advised that he probably, because of his developmental disability, wasn't in a great position to understand certain risks that he was involved in, that he shouldn't really be walking through public parks, that he shouldn't be engaging, because he reported he would ask different people in the park different questions, and then he would end up being sexually assaulted and then would freak out about it. So the family was advised that they needed to teach him better about not talking to strangers. All solid advice, made sort of sense. I had done some work with clients with developmental disabilities, so that was part of the reason that I had gotten the case referred to me. Within 1 or 2 sessions, it was clear to me that his developmental disabilities were really quite moderate and minor. This young man had a great capacity to understand, much more than I think anybody else actually gave him credit for. So in my head, there was a disconnect here. There were questions that I felt weren't being asked somehow, and I began to ask those questions. And the most obvious one to me was, each time that this happened for you, the report was that you were stopping people and asking questions. What kind of questions were you asking people? Well, it became very clear very quickly. He was asking these men about what it was like to be a man and what it was like to be involved in sex with another man. We had a young man who was early on beginning to explore his own sexual orientation and identity. And he knew he couldn't explore that at home. And he had heard that there were people that he could ask it of that wandered around in these parks. And so he was going there really to try to find basic information. But nobody had ever asked that piece of the puzzle, right? So we chalked it up to, here's a young man that just doesn't have the cognitive abilities here and we need to protect him. Then this is a young man that actually needs some basic information, sexual health information. And we need to find a way to provide that to him. I want to add one other piece to this, which is probably the most difficult and sad part of the case to me, and the one that probably galvanized me most in terms of my work. We also, as part of our services at the organization, test all of our kids for STIs if they've been involved in sexual experiences. He ended up testing positive for HIV. And in talking to him about that, I had asked him whether or not he had ever gotten any basic information around prevention around HIV and STIs. And he had told me he had in 6th grade. And he told me that, interestingly enough, that he actually always traveled with a condom in his wallet. But his understanding was that he needed to use that condom if his penis ever went into a vagina. And that did not happen in this experience, so he didn't think he needed it. It really underscored for me the importance of also asking our systems to look more broadly at the information that we provide to kids, the sexual trauma risk for kids when they're not given information that is specific to who they are and how they operate in the world. This kid had gotten a heterosexual paradigm for sexual health that didn't match who he was, and therefore he thought he was fine. And then we end up with this happening, the sexual trauma and also HIV, a medical sexual health consequence, because we weren't understanding the full picture of who this young man was.
And would you add to that potentially? Did you learn anything about how he felt his family would view his possibly being of a non-traditional, non-heterosexual identity?
Yeah, that was a really, this is projection on my part and guess on my part because I never got the opportunity to work very closely with the family. They weren't interested in partnering with us with family work. They would drop him off and leave.
Fix him.
Exactly. My sense is the family actually had a clue earlier on that this was going on as well, but that represented such an enormous, almost violation of who they are and their values around that. They could not grapple in any way that they might possibly have a child in their family who was gay or had same-sex sexual attractions, that even if they had the gnawing sensation that this may have been part of the dynamic, they couldn't go there. And again, then the risk and the harm that resulted because of our unease around all of that.
So there's yet another layer of culture
Absolutely.
that was impacting this young man and his experience.
Yeah.
That's very powerful.
It's interesting. They're also more accepting of the fact that he has a developmental disability than his sexual identity.
Absolutely.
That
Absolutely.
was
They
much
had done
more comfortable for them.
Totally. Totally, and had been incredibly supportive around that and made accommodations around that and studied really hard to understand what all of that meant. Right,
Yes.
Exactly. That we can, that's okay.
Some
This other
differences are
part,
okay, but
that's
not
right.
others.
That's right.
And that differs for each family and each culture. And we don't know going in whether that's the case. He could have come from a family that was completely accepting of him being gay. But if he does, then we don't want to assume that because he's Latino and his family is probably of Latino background, we don't want to assume that they wouldn't accept. And yet, when they don't, then of course that's just another layer that this young man's dealing with. Think of each of the mother, the son, the Cambodian family, the father that each of you is talking about. So each of these people is basically bringing a very complex cultural, intergenerational, as several of you have pointed out, background that involves beliefs, norms, expectations, what's allowed, what's not allowed, prescriptions, proscriptions, and it seems like that's a lot for us to keep in mind. How do you keep that all in your head, especially when you're working with, for example, kids and families where they are experiencing intense dysregulation because of developmental trauma that they've experienced or historically has happened? How do you keep that all in your head? What do you do?
I think that conceptually these understanding, or I am growing in my understanding of intersectionality, has been very helpful in realizing that our identities are multiple and that in some areas we are targets of oppression, in some areas we have privileges, and then that when we are in front of the other, we are representing, they are not seeing us.
As we see ourselves?
Exactly. We represent all these very complex identities, right? Like in the example that I gave of the mom, the way that I was perceiving my identity at that point was very different than how she was perceiving me, because I was representing the other who was an oppressor, right? So I think that this idea or keeping these in mind for me in understanding, my identity as complex and that it changes and it's becoming helpful in understanding more about diversity and, as social justice and all of these linked, right? That is beyond or more than culture or race, but that we are very complex beings.
That the concept of intersectionalities, that's a really interesting metaphor. I find myself thinking about how when I'm driving in an automobile, I don't think about all the different intersections that I'm going to have to go through. And yet, as I go through each of them, I have to be aware of where the traffic's coming from, whether I'm going in the right direction, if I'm in my lane. And I don't want to overextend the metaphor, but I think that just helped me have a frame of, okay, right at this moment, when I'm with this particular client, family, individual, whomever it may be, I'm at these intersections. And I don't have to necessarily know about every other single intersection. I need to have those in the back of my mind to be aware that there may be others coming up, or there may be others that I've gone through and unwittingly gone through one and not stopped at the stop sign, or not yielded, or not fully been aware of the other persons involved. But at that one moment, I'm in this intersection, and it may be six-way. It may be very complex, but that's what I need to pay attention to right at this moment.
Right. And I appreciated your bringing the intersectionality and to this, and the complexity both of their identity, but also how they're seeing us it's almost mind-boggling. There's so many different pieces to this puzzle. And I think one of the problems, like in our field, is like manualized or very focused interventions, and you get this kind of narrow, time-limited approach in which you're not going to have time or an opportunity to ask the broad enough questions to get a sense of the complexity, of the nuances of their life, the multiple identities that are key and that are present in the room here. And so that goes. Another thing that as I'm getting older is to allow time to ask some of these broader questions and to allow the time for that work.
Yeah, I love that you said that. I was thinking the exact same thing. When you asked the question, Julian, for me, I don't think it's so much, how do I keep all of those intersections in my head. I think I do a relatively good job of that. It's, did I ask about them to begin with? Am I aware that they are there? And I agree with you, Bill, that I think one of the areas where I am concerned as an elder in the field now about where we're going is that the whole concept of doing a thorough assessment, a real clinical assessment, I think is starting to disappear. We jump right in. We have 2 lines of a description of a client, and so we know which kind of recipe treatment to start.
Right.
I know nothing about a client based on that bit of information. We used to take literally multiple sessions to get to know a client, their family, anybody else that would give us information, and that's where we learn about all these other aspects of how they identify and their experience with other systems. And I think we run a great risk in terms of really addressing on a real and lasting level change for a client when we don't even know who that client is because we haven't asked.
And if I might add something also, when we don't ask ourselves, or we don't have the space to engage in a consistent, critical self-reflection process where we are looking at all these aspects of our identity and how they might become bridges or obstacles in the work, because we have implicit biases. And then if you are rushed and don't have, again, the space to reflect, or reflective supervision or peer supervision, or some space where you can have difficult conversations, that then the work is placed on the patient or the client, and we began to investigate or gather information from them, but leaving ourselves out.
I think that for me, conversations such as the one that we're having are very helpful. Understanding that we are not coming with solutions. Maybe we're coming with more questions and more things that we're being touched by, but at the same time it's so valuable because we need to keep on challenging ourselves and challenge each other to keep on doing this work, right? But the other thing that I also find very helpful to me is going out and learning more about the communities that I'm serving. So, by going out and taking out my clinical role, which many times is very easy for me, as a Latina woman, depending on the community that I am in, I can actually, be there and notice too. And but just listening, learning, knowing what's going on, many times that helps me to broaden my perspective of things that are happening, and that informs me. So the work is a hard work. It is really hard, and it's actually, but it's so rewarding when we keep on doing it. And I think that the invitation for me is to keep on growing and hopefully becoming a better human being each time that I throw myself out there. So that's.
Monique, I was thinking that this wonderful framework that our colleagues are sketching out here of taking the time to really observe, learn, truly get to know the people we're working with rather than just dropping interventions on them.
Right.
That must be particularly challenging to do and to find the space to do in settings like the correctional settings where you are working.
Right. When you work in a setting where the young people live or stay, so it is a residential program, you are managing many components of that deal with culture. There's the correctional culture or the justice culture, and it has its own set of values, belief systems. And if you work with, whether we call them the new term youth leader, which is supposed to be designed to help people and see these young people as, to see the old corrections officers as actually people there to have relationships with kids and to change things through relationships. Whether you call them that or juvenile correctional officers or probation, whatever they are, they have an entrenched culture that often was built at a time when young people that were placed in residential placement because of a crime or that they committed saw those kids as in some way needing greater structure, discipline, support, that, if they had the upbringing they needed, the parenting style, whatever, they would be better. And so that's a culture that many times believes pretty significantly that punishment is the route to go. And so you're balancing, and as a therapist working in that environment, you know, I have a very therapeutic belief system philosophy that I was taught coming into my program. And so we kind of have this clash of belief systems around what is best for the young people. And so for me, one of the things I learned very early on was, I can't say early on, after a few years, was that if I can take the lens that it's really important to take the time to get to know the individuals that interact with one another and try and understand their perspective without dismissing it. So to just simply say to an officer, "You're wrong," or, you know, how horrible is that thinking?
How cruel could
How
you be?
cruel could you be? Is not helping the situation, because they develop that belief system out of their training, experience, background. And so when I look at systems that are struggling now, often what I'm looking at is you have this tug of war. And I think when we begin to say everybody's goal is to be safe, I think physical safety, psychological safety, emotional safety is the goal. And if we begin with that as the goal, then I understand that that officer wants to go home every day and not get assaulted. And I understand that that kid wants to get through the system and not be harmed by other young people, and be able to be successful at that. And my goal is also to make sure that everyone is safe. So I really focus on, you know, how do I work with individuals in a way that acknowledges the need to ensure that they feel safe in our conversation, that there aren't put downs or setups. And to me, that has to begin to some degree with getting to know them as human beings. Who are they? What are their desires? What are their goals? And how do we bring our joint understanding or desire to a common place in terms of the interventions? When I'm working with young people, I try my best to understand who the young person is. I look for the opportunity to have consistent staffing that I can work with to help them to be able to understand who the kids are, what their individual needs are, to also meet the staff's needs for that feeling, which I think is important. So I think having a lens that's really focused on all of the dynamics is important, but I can tell you that that is a challenge.
You're really articulating the parallel process where we as therapists, if that's our role, we can really focus in on our clients. And that's, of course, incredibly important. But we know that they have families, they have history across generations often, so we need to know about that. But then you're now raising the point that they're also our colleagues. And there are colleagues who are sometimes perceived as our adversaries. They're part of the system. They represent a whole different culture that's more punitive and we're more therapeutic. But they're our colleagues. And they're working with the same clients, perhaps from a different framework, but maybe with that shared goal. That's what I think is really powerful in what you're saying. Safety is one really, really important example of a potential shared goal that people from multiple cultures can begin to join around. Then there's the question of what does safety mean to each individual and from each culture and each background, because my safety is not necessarily my colleague or my client's safety.
Right, and I think that's important.
And that kind of goes back to Rocio's comment where if you make a report, you're doing it on behalf of the safety of a child. But is that the safety that a father or a parent sees when they see this as potentially another separation, another way of pulling them apart from their child or their family that reduces their safety? So now your safety is not a father's safety, although then is there that common ground? And that's
I think, an important one. If I could give an example of one that I think about in terms of scenarios, I'm often asked to look at facilities in terms of some of their policies. And one of the big ones is suicide prevention or self-harm. And I was working with a program that actually asked me to review their policy and to look at a couple of cases that had come in. And one of them was a residential facility where it was an all-female facility, adolescent girls, and they were looking at how could they manage the issue of a young woman threatening to harm herself with their own garments. So whether it be their undergarments, some portion of clothing. The facility's perspective was the safest thing to do would be to remove her clothing.
No garments.
So I don't have garments.
Right.
So she physically will not be harmed. And yet and unfortunately one of the things they did was use a tool to cut some of the clothing off in addition. But in their, it really was their belief system that was going to create a greater sense of safety. And so we had to sit down and talk about the backgrounds of the young women that they served, many of whom had been sexually abused, physically abused. Some of them were had been forced into the sex trade in some way. And so talking about, let's look at it from the perspective of that young woman. If female officer comes in and they're removing garments, the sense that how powerless that person feels, how intrusive that is, how how important that is, and because what they would then see is, and then she just gets more violent, and said, well, it makes a lot of sense when you think about she emotionally, psychologically feels very unsafe, and then you look at the other women on the unit who are often in their rooms, doors locked. They can't even see what's happening, but what they hear is, "Get off of me! Don't touch me! Why are you taking my clothes?" And so there's a trauma that's happening across.
Reliving.
Right, and so we had to figure out how do you deal with the intersection of ensuring physical safety, while also being attentive to the need for psychological safety.
Yes.
And so it required a different type of strategy de-escalation. And time becomes important because time and resources in programs mean if you sit and you talk to a kid, it's one less person to supervise. But that is so critical to how the rest of the day goes.
I'm thinking about this in terms of another dimension of intersectionality. We talk about the multiple layers of the client and how that interacts with the clinician, and now a third dimension, they're working in a setting that has a specific culture and limitations in terms of how they intervene, as well as a belief structure, which you're saying that is, so we're kind of hitting it's like a three-way billiard shot. When, we train in different settings. I train in schools, juvenile justice, and the other third factor we have to take into account, as if it's a whole other person, is that facility and the culture and belief structure. And so that becomes, that's kind of expanding my mind in terms of this kind of three-dimensional chess you gotta be doing to intervene and to try to have well-informed, trying to move the ball down the road, and how arduous that can be when you're working with staff. Well, you've got to go through their lens and where they're at and really validate that. They come to their point honestly, but that's an equal part of that intersectional thing.
So Bill, when you're adding a third dimension, then there are so many additional dimensions, not to overcomplicate things, but think about in the system, kids involved in juvenile justice, kids involved in the mental health system, they're so often involved and their families with the child welfare system. And that's another system that then has another way of defining at least how to get to safety, sometimes even what safety is that's quite different. Rocio, I saw that you wanted to add.
I'm thinking about, many times how that big system is so afraid and fearful about what's going to happen, right? What's going to happen with the kids who are telling us that they're they're thinking about harming themselves, right? Or for a clinician, what's going to happen if I don't make a report and this child might be at risk, right? And how do we, as a whole system, what are sort of the teachings about what to do when we are afraid and fearful, right? And how can we hold that fear as a system level, institutional level, clinician level, so there are different ramifications towards it.
So I'm going to ask as we wrap up, having had this wonderful chance to hear one another's reflections on these really complex issues, what's the one take-home thought that you're going to take away from this? I'm going to start with Bill, and let's just go right across the group, okay?
Well, this has been you're opening my mind here as well. The complexity of the what's going on in the counseling room, whether you're working with an individual or a family or a couple, and how we need to hold up our end and not put it on the client. And that was a key thing that I got. We got to do our work and being proactive in the way that Al was saying too. And so we've got to be ready for that and we've got so much to keep track of. I think it's doable, but it's essential to not oversimplify or do this work or to go into it too quickly and unmindfully.
Wonderful. And I won't pull a therapist on you and say, make that an I statement. But I think you were saying, I'm going to.
I'm going to work on that.
Thank you, Bill. Carmen.
For me, I think that it will continue, or it has reignited me to continue bringing the message about the importance of creating spaces for self-reflection. And, I have the privilege of doing training, so I think that that is something that I must continue to promote and to bring up. And then at the clinical level, this continuous process of self-search in terms of, what is happening with me every day as I continue experiencing the world, again, as a woman of color with whose identity is impacted in many ways, and what does that mean in terms of my clinical work?
How fortunate we are, and how the therapists who you're able to help support in self-reflection, for them to know that you're doing that work too. Monique?
I think what I take is continually focusing on what is safety and understanding it in context, cultural context, systemic context. What are its multiple meanings to people, to include systems which often, as Rocio spoke of, can develop fear. The director or CEO develops a fear of attack from whether it's advocates or from legal challenges, but that there's a need to help that individual understand how do you respond in fear in a way that is appropriate, and how do you make decisions, and how do we as systems, we as individuals and systems, regulate self in order to be able to do this work.
Yeah, fear is not just a pathology, fear is a reality that we all contend with.
Yes.
And safety is a possibility that we all perhaps have the opportunity to facilitate. Thank you. Al?
This is so hard to try to narrow it down. There's been so much that's gotten kind of activated for me as I listen to my incredible colleagues answer these questions. So I'm going to just sort of tie together a little bit of some of the things many of them have already said. But first and foremost for me is an appreciation of the privilege we've all had today in doing this.
Yes.
And how, in my perspective, how unfortunate it is that this is a rare opportunity. The work that most of us do, we actually do quite oftentimes in isolation. We're in our little silos, it's us and our client. If we have the fortunate access to a supervisor who's good and knows reflective supervision, that's great, but most folks actually don't. And so then we're off doing it on our own. And I'm also struck by, as I think we've all sort of alluded to, these changes, these challenges that we have in front of us. While it is helpful to have some big picture idea of what change looks like down the road, change happens person to person. It always goes back down to relationship, right? That's I could be trained in 1,000 different techniques, but if my client doesn't feel safe with me, my client is afraid of me, my client doesn't think I understand who they are, doesn't matter how well versed I am in those techniques are going nowhere. And the only way I get better at forming relationships and being better at them is by doing this, by putting myself out there. This project I love in that it asked us to be vulnerable. We're all kind of raw out here saying our stuff, and that's scary, but that's also how we get better at what we do. And so I'm very appreciative of this incredibly rare opportunity that we've all had.
Well, thank you for giving us as your colleagues and your colleagues who are viewing and listening to this permission to actually do the reflection and maybe say when we don't have the answers and say when we don't feel like we're quite connecting, just as you give your clients permission to do that. Rocio.
So I think that my takeaway message for me is that I still have a lot to learn. I still have a lot of growth to do. And, I think that one of the things that I have value in this experience is how I have held my vulnerability. And even though it has been very uncomfortable at times, I think that there is a value on having these conversations. So I hope that we keep it up.
Oh, thank you. And your humility is so clear and so authentic. And I want to thank all of you because for me this is just such a rich experience to be able to hear about the challenges you faced, what you've learned, what you're still struggling with. That helps me not feel quite so alone. And I think it's probably going to be very, very helpful and inspiring to a lot of people who will join in and will view this dialogue. And then we'll want to be talking to all of you. So get your emails ready. Thank you all again.
Thank you.
Thank you.